I tell lots of parents about in my classes is making sure that mum is staying hydrated during labour. Now, the idea behind this is not just because we don't want them to be dehydrated, which obviously we don't, but what we don't want is the dehydration to cause a change in the labour plan. So, for example, if a drip was needed, then they're probably going to be moved to a labour ward setting as opposed to a birth centre. So, stay hydrated in labour is a really important tip. And using things like isotonic Lucozade, still sports drinks, that kind of thing is going to really help that as well. So definitely pack that in your hospital bag. And then the next thing is making sure that they go to the toilet. So if you're a birth partner, a dad, or you're going to show this to them, what the message is make sure that you're staying hydrated, but then you are going to the toilet as well. And the idea behind that is that if you've got your pelvis and then in there is a full bladder, so the bladder is going to be sat there full and not emptied after drinking all those drinks you've just kind of asked your partner to drink. Now, when the baby enters the pelvis, what's going to happen is they're going to be blocked by that bladder. So if that bladder is full and it's just they can't get past it, that is something that's so small that could really stall that phase of getting them to be established and getting them in the birth canal. So making sure that you empty that bladder is really important to be able to make more space for your baby, to be able to get through and be born.